Hello, everyone. I'm Dianna Ng, a pathologist and global cancer researcher at Memorial Sloan Kettering in New York City. Today, I'll be talking about my leadership journey project titled Cultivating Leaders to Promote a Culture of Continuous Quality Improvement in Pathology. But first, I'd like you to imagine a woman in her 40s with two young children. She's just discovered a lump in her right breast. And as hard as it was, she saved enough money and carved out the time to go to the doctor to get examined and get the lump biopsied. While waiting for her pathology report, she wonders how a diagnosis of cancer will impact her future and her family's future. She anxiously waits a week, then 2 weeks, and then 4 weeks for a result. And when she finally gets her result, it's indeterminate. This ordeal will ultimately delay her breast cancer diagnosis. Why did this happen? To understand that, we need to know why pathology is important and why quality management is essential to any cancer system. Pathology is often the invisible clinical specialty, but it is essential for patient care. It's needed for diagnosis, assessing disease severity, determining prognosis, identifying the best treatment options, monitoring clinical responses, and providing data for cancer registries. But pathology is complex, and often for a lab to function properly and to avoid indeterminate and poor quality results that can have devastating emotional, financial, and clinical outcomes, a high quality pathology laboratory requires a robust quality management system and a culture of continuous quality improvement. A quality management system is a comprehensive program that analyzes every aspect of an entire laboratory operation and is the foundation for providing safe patient care that is accurate, reliable, and timely. A culture of continuous quality improvement is a mindset that pushes us to ask, what can we do better, not only in the laboratory, but for our patients? What many don't realize is that pathology is a complex specialty that involves a large number of staff, including technicians, clinical scientists, pathologists, and administrators. It also requires expertise in operations, technical matters, and communication. This is why specialized leadership is essential in the pathology laboratory. However, many laboratory staff and pathologists receive only minimal training in quality management. Therefore, I am proposing the introduction of a global online fellowship in quality management. This will ensure that all patients, but especially women, receive the most accurate, timely, and reliable diagnoses possible, regardless of where they live. The design of the fellowship is based on a needs assessment we conducted of breast pathology services in 3 large referral hospitals in sub-Saharan Africa. This fellowship will provide a strong foundation in quality management skills through lectures, assigned readings, and more importantly, small group discussions moderated by content experts. All participants are expected to design and implement their own quality improvement project at their institution with an assigned mentor. And the goal of this fellowship is to provide skills so that participants are able to independently create effective solutions for local problems. In 5 years, it is my hope that the program will be led by prior participants, whereby the trainees become faculty, and that with every passing year, we are able to accommodate an increasing number of participants. And finally, this takes me to my own thoughts on the leadership journey. In reflecting on the 4 pillars of leadership at WomenLift Health, I've come to understand that to be an authentic leader, it's important to identify a collective vision guided by compassion and integrity. To be an inclusive leader, one should not only take space, but also make space for others. To be a strategic leader, it's okay to be iterative and to apply the plan, do, check, act framework, which is a critical qualitative improvement framework to matters outside the laboratory. And to be impactful, it's important to always keep the end goal in mind, which is to increase access to excellent cancer care everywhere. Thank you.